Hi everyone, welcome to today's Hepatitis Awareness Month webinar. My name is Alyssa Kitlis and I am a manager in NAFSA's Hepatitis program. And today I'm joined by my colleague Kate Morales from Hep B United, as well as a number of great speakers who will share resources that are available for Hepatitis Awareness Month, and as well as examples of what health departments and community partners have done and are planning to do this May to raise awareness about hepatitis B and C. And I just received a question about videos, and there won't be any videos for this. So if you can hear us, we're all set, but we won't be doing any video other than the slides. And as you know, Hepatitis Awareness Month is an opportunity every May to highlight the importance of addressing hepatitis. And we are reminded that millions of Americans live with chronic viral hepatitis, and as many as 3/4 of them are unaware of their status and are not connected with care or treatment. This Hepatitis Awareness Month comes just a month after the release of the National Academies of Science, Engineering, and Medicine's Phase 2 report on the National Strategy for Elimination of Hepatitis B and C. And this report really drove home the point that we have the tools to eliminate hepatitis as a public health threat in the United States, but we have to make it a priority. So for this Hepatitis Awareness Month, it is a great opportunity to start making hepatitis more and more of a priority, and we are really excited to have you all joining us here today to discuss different ways we can call attention to this critical issue. So before we get started, I'm gonna turn it over to Kate to open up a poll for discussion to see who's on the line.
Great, thanks Alyssa. Hi everyone. So we're going to go ahead and open up our first poll question. And you should see it pop up on your screen. And the question is, where do you work? So tell us a little bit more about where you're coming from. And we'll give it a minute for the answers to come in. Alyssa, just let me know when you get a good number of responses.
It looks like, yeah, we're all set. So it looks like the majority of folks on the calls are actually from health departments, and then also community CBO partners, national nonprofits, and others. So I'd be curious for the folks who responded others, where exactly you're coming from. So if you wanted to type into the chat box to share where you're joining us from today, that would be great. So I also, before we get started, wanted to just cover a few logistic items. All lines other than the panelists are muted. Oh, sorry, I realized I didn't share the results, so everyone can see where folks are coming from now. So all lines are muted during the call until the Q&A and discussion portion. And then we'll provide some information about how you can unmute your line, but there is a chat feature, as I'm sure you've seen, and at any point you can ask questions or share your responses if we pose questions to you, or chat with other people on the webinar, so that's a great space. And we do really want to hear from you throughout the webinar. And then, as I mentioned earlier, there is no video, but we are recording the presentation, and we'll make the recording and the slides available following the webinar. So we will get started, and if anyone has logistic questions as well throughout the webinar, please send that either to everyone on the call or directly to the panelists. So for those of you who are not familiar with NAFSA, NAFSA is an association of state, territorial, and directly funded local health department HIV and hepatitis programs, and our vision is to see a world free of HIV and hepatitis. And we have had a hepatitis program since 2000 and support the viral hepatitis prevention coordinators in each jurisdiction and other health department hepatitis staff, such as directors and surveillance staff in a number of ways through regular work group calls, annual TA meetings, and ongoing TA opportunities such as this one. And as an organization, each year we have a Chairs Challenge. And in 2016, our Chairs Challenge is ready to end the HIV and viral hepatitis epidemics, where we've been highlighting health department efforts to eliminate HIV and hepatitis C through success stories. So for us as an organization for Hepatitis Awareness Month, we are going to be highlighting state and local efforts to eliminate hepatitis C in our success stories. So we will actually have a story from NHEP-CSF, New York's Elimination Summit and their efforts at the state level, and then Oklahoma about how they're supporting the Cherokee Nation elimination efforts. So we're really excited to share the work happening across the country during Hepatitis Awareness Month. And also at NASDAD, we focus on advocacy and policy work. And so this May, we will be releasing a call to action that will urge decision makers to make hepatitis a priority in the United States and hopefully complement the National Academy's report and really call attention to the need to address hepatitis, both in May and then throughout the rest of the year. So that's a little bit of an overview of what we're doing this month in addition to this webinar. So I'll turn it over to Kate to tell us more about Hep United and what you're doing for Hepatitis Awareness Month.
Hey, thanks, Alyssa. We could go to the next slide. So Hep United, we're a coalition, we're a national coalition established by the Hepatitis B Foundation, where I work, and the Association of Asian Pacific Community Health Organizations. We're organized across, here on the map, across 22 cities and 18 states, including the District of Columbia. And our partners are working across the country to raise the profile of hepatitis B and liver cancer as an urgent public health priority. We're working to increase Hep B testing and vaccination and improve access to care for individuals living with hepatitis B in order to prevent liver disease and liver cancer. And I wanted to highlight a few activities that we have planned nationally starting next month or next week in May for Hepatitis Awareness Month. The first item is a directory of May Hepatitis B Awareness Month activities. We have a directory of about 11 states where you can find where Hep United partners are located and find free Hep B testing and vaccination, education, community forums, even advocacy events. So you can check out the full listing at Hep United, www.hepunited.org. And then I also wanted to share with you a social media campaign that we will be launching in May with our partners, where you can find Oliver. And there is a picture of Oliver right there with his suitcase ready to travel across the country. So Oliver's Travel is a social media campaign designed to increase awareness about Hep B, encourage testing, find out what Hep United partners are going to be up to over the next month. And Oliver is a healthy liver. So Oliver will be visiting the coalition partners from the East Coast to Hawaii, and he'll be circling back for our annual Hep United Summit in Washington, D.C. to celebrate World Hepatitis Day in July. So look out for photos of Oliver with Hep United coalitions, and it's going to be via the hashtag Oliver Travels. And then finally, I wanted to share with you a congressional briefing that we'll be holding on May 24th. The Hepatitis B Foundation, with our partners at APSHO and VHR, will be hosting Conquering Hepatitis B, a Roadmap for a Cure. At this briefing, we'll be presenting a research plan and discuss the needed investments needed to find a cure for hepatitis B. So the briefing will also feature 3 patient advocates who will share their stories about hepatitis B. We'll also be screening digital stories that they created over the past couple of months from a new campaign that we're launching next week, hashtag JustB. And I will share a website with you on the chat box. Right. Thank you.
Great. Thanks so much, Kate. So today we are, I mentioned, joined by a number of speakers. And first we have the pleasure of hearing from Amanda Carnes and Sherry Chen from the Division of Viral Hepatitis at the CDC about what resources are available for Hepatitis Awareness Month. So Amanda Carnes is a health scientist on the education, training, and communication team at DVH, and during her 6 years at CDC, Amanda has worked both on national education campaigns, the No Hepatitis B and No More Hepatitis, and she currently leads the division's social media efforts and Hepatitis Awareness Month activities. And Sherry Chen is also a health scientist on the education, training, and communication team in DVH. So I will now turn it over to Amanda and Sherry.
Hey, thanks, Alyssa. Oh, great. Okay, so as Alyssa mentioned, we will be talking about some CDC resources that we have available for Hepatitis Awareness Month. So next slide, please. So for Hepatitis Awareness Month, our objectives include raising awareness for about viral hepatitis, encouraging testing on Hepatitis Testing Day, which is May 19th, and promoting our online risk assessment. And we do this by generating news, sharing resources, and engaging with our partners on social media. Next slide. So some of our resources, so for our Hepatitis Awareness Month webpage, we list out some resources that are available for partners to use with their local Hepatitis Awareness Month activities. So on the next slide, we have some of our resources include Hepatitis Awareness Month and Hepatitis Testing Day buttons and badges. And then next slide, please. And then we also have some resources, including live read radio PSAs that you can submit to local radio stations, proclamations that you can help get issued, and a feature about different types of viral hepatitis that y'all can share. Next slide, please. And so then also we have posters that you can order for free. And if you go to the link provided, you can select posters that you would like to order, and it'll take about 2 to 4 weeks to ship. And yeah, so next slide. Oh, next slide, please. Thank you. So we also have some campaigns that we have launched that help raise awareness and promote testing for chronic hepatitis B and C. And one of our campaigns is the No Hepatitis B campaign, which promotes testing for chronic hepatitis B, particularly among Asian Americans. There have been 3 phases so far since 2013, and we are planning for a new phase later this summer. During the phases, we released resources in multiple languages, including Chinese, Korean, and Vietnamese. And these resources encourage testing for hepatitis B, and we allow modifications for local communities and events. So to download, print, or share any of our resources, you can visit our website, which is listed at the bottom of the slide. Thank you. So on this next slide, we just have a wide variety of resources in multiple languages, and in the next few slides, I'll go through a few of them in more detail. Next slide, please. So we have 4 TV PSAs in the 5 languages listed. You can download these PSAs or share them. And then on the next slide, we have some patient education fact sheets, which have been adapted for multiple audiences. And these are in English as well as in 7 languages for Asian American communities that many of our local coalitions are seeing. And in addition, because we've heard needs for it, there are also versions of our fact sheet for Native Hawaiian Pacific Islanders as well as African immigrant audiences. Then on our next slide, we also have a variety of resources that can be used in promoting local community events and educating patients and promoting follow-up care. And finally, next slide. We have some examples of what our partners have done in the past. So people have added their contact information to posters, customized flyers for upcoming events, use posters and other resources to decorate tables and booths, and use our hepatitis B quiz template to create an actual game that you can draw participants to their tables and to their events. So next I'll turn it over to Amanda, who will talk about the rest of our campaign. Thank you.
Hi, everyone. I just wanted to briefly talk a little bit about our other national campaign, No More Hepatitis. This is a multimedia campaign that is designed to increase awareness of hepatitis C and encourage those born 1945 to 1965 or baby boomers to get tested. We have 3 phases since the launch in late 2012 before the recommendations to test baby boomers were released. And kind of in coordination with our B campaign, we also hope to release the 4th phase of our campaign this summer. Audiences for this campaign are, again, consumers born from 1945 to 1965 and also primary care providers. And here you can see a website for our campaign, which can also be found on our overall DVH website page. Next slide. Here's just a brief overview of some of the campaign materials that we have with the No More Hepatitis, which is the C campaign. We have video PSAs and radio PSAs. We also do some digital advertising and some social media posts and commentary. We also have print and out-of-home placements. Some of you may have seen our airport dioramas that we have across the country. We also do some print ads, we have billboards, and we also have transit ads. We also have patient education tools, including free posters that you can download or order. We also have a fact sheet for baby boomers, which is also translated into Spanish. And we also have a few other print ads that you can download from our website. We also have provider clinical tools that focus on hepatitis C testing recommendations. Next slide. Here's just a screenshot of the 4 PSAs we currently have with our campaign. These are found on our campaign website and can also be found on CDC's YouTube channel. You can download these or you can share them electronically through CDC YouTube. Next, please. Here's just a brief glimpse of some of the campaign resources we have. Again, we have posters, you can see our fact sheet there, and we also have some really neat infographics that we developed that highlight the different key messages around getting boomers tested for hepatitis C. One thing that we wanted to discuss is just to let everyone know that our campaign materials are in the public domain and are free for you all to use, however fits with your organization and needs. We are also open for suggestions for new materials, but hopefully you can find our materials useful. You can use our logos, you can use our materials as long as they are for their intended purpose. And you can visit both the No Hepatitis B campaign website and our No More Hepatitis website to find logos and usage guidelines for our materials. It's spelled out pretty simply there, but if you have any questions, you can contact Sherry and I. Here's an example of some of the provider clinical tools we have. On the left, you can see some content that is for around hepatitis B, and on the right, you can see some content that's focused on hepatitis C. We have algorithms available, webinars, counseling and testing manuals, clinical trainings, and we also have been working with one of our grantees, University of Washington, to develop a website called Hepatitis C Online. And all of these professional resources and tools you can find on our website, www.cdc.gov/hepatitis. As Sherry mentioned earlier, one of the key components of our Hepatitis Awareness Month activities is promoting our hepatitis risk assessment. The purpose of this tool is that it was designed to assess a person's risk for hepatitis A, B, and or C, and also provide them tailored vaccination and or testing recommendation. So the audiences for this tool are baby boomers, Asian Americans, people with past risk behaviors or events, or really anyone that you all would like to see if they should get tested or vaccinated. The tool is designed to use in the privacy of people's homes or at health centers or at the doctor's office, really anywhere that you can have an internet connection, this tool can be used. And like I said, basically you go through the tool, you answer a series of questions that take no more than 5 minutes. And at the end of answering the questions, you will actually get tailored recommendations that have that you can print out and take to your doctor to discuss, and they will provide information on whether you should get vaccinated or tested for viral hepatitis. We do have some resources available to help promote the risk assessment, some buttons and badges and some other items, and that you can find those at the website on this slide. So finally, just to get involved and stay connected, one of the main ways you can do that is to sign up for our monthly email listserv. It's actually, you can find it, you can see the red square. It's on our main page of our www.cdc.gov/hepatitis website. It's a great way to stay in touch with us and get information on any recent activities, events, publications, etc. And again, it's really only sent once a month, maybe twice a month in busy times around Hepatitis Awareness Month or World Hepatitis Day. But it's designed to not clog your inbox and just give you a brief overview of what's going on here at CDC. Also, if you are on social media, please follow us on Twitter at CDCHep. Our account was started in 2009, and up until this point, we've been able to grow it to over 33,000 followers. A lot of the posts are used to support our recommendations and our campaigns here at CDC, also any publications that come out, but we also use it to communicate with partners and really help others promote their resources as well. Also, during May and beyond, we support and promote our Get Tested website here at CDC. This website is a great tool that allows consumers to enter their zip code and actually search for ongoing testing and vaccination services in their area. Also, if you visit the site, you can also go online and fill out an online form that's really simple that can allow you to register your vaccination and testing services within this website so that your services can be present. And lastly, we just wanted to kind of put a plug out there for our Be HepAware Thunderclap. We've done this a couple years now, and we've really found it a great tool to allow people to kind of sign up and support the cause. It's designed to further raise awareness and promote testing during May, so we hope you'll consider participating and supporting the Thunderclap on May 19th at 12 p.m. Eastern. If you aren't aware, Thunderclap is a tool that allows supporters to sign up in advance and share a unified message simultaneously across social media platforms to create a wave or thunderclap of sorts. We actually need 100 supporters for the Thunderclap to take effect, so please visit the website here on this slide or go to our Hepatitis Awareness Month Resource Center to find more information and sign up. We hope you'll share this with others, and if you have any questions about this or any other things that we've presented, please contact me or Sherry, and we will be happy to discuss. So thank you so much.
Thank you so much, Amanda and Sherry. So we will hold any questions until the end, but please remember to feel free to send your questions via the chat box throughout the presentations. Next, we'll hear from Wenqi Chen and Ruth Brogdon from the New Jersey Hepatitis B Coalition at the Center for Asian Health at St. Barnabas Medical Center. Wenqi Chen serves as a program coordinator for the Northern New Jersey and New York City Hepatitis B program called Building Bridges to Liver Health, which is a 3-year CDC-funded project. She's also the patient navigator at the Center for Asian Health. And Ruth Brogdon serves as the grants manager at the Center for Asian Health at St. Barnabas. Both Ruth and Wenqi have extensive experience working on hepatitis B. I'll turn it over to Wenqi and Ruth.
Thank you. So everybody here as well, right?
Yeah.
Okay.
Yeah.
Okay. So no background. Okay, good. So next slide. So every year, May, it's our busy month for Center for Asian Health and also for New Jersey Hep B Coalition, because we want to raise awareness in the community, not just in the community, also in some of the professional field. So our promotion events on May, we kind of devise different categories. We have a hospital-based event, and then also we have the community-based event. of course, the media campaign is one of our major promotion on May. So for the Awareness Month last year, we did a lot of promotion events to raise the awareness of hepatitis B. We screen the staff in the hospital, also open to the patient, family, and friends. Instead to screen people, we also have educational booths in the cafeteria to catch the foot traffic. And then also we provide the lunch and learn to raise the awareness of hepatitis B and educate the residents in the hospital about hepatitis B screening. Make sure we also make the reminder in our EMR to remind the residents to order the hepatitis B test on some of the patients who has a high risk. And then, so next slide. So I'm going to ask Ruth can talk about the community base.
Hi, everyone. I'm just going to talk a little bit about our community-based activities, which are two-pronged. We are involved in promoting and awareness and education of hepatitis B, as well as providing free hepatitis B screening. With regards to promoting awareness and education, we provide educational talks around our community. Our educational talks will involve two ways. One is Dr. Sue Wong, our medical director for the Center for Asian Health, will provide an educational seminar to those community attendees, just the general background of hepatitis B, transmission, prevention, screening, treatment, and helping to break down some of the common misconceptions of hepatitis B. In addition to the educational talks, we also provide our presence at an educational table in the community where we are basically handing out a lot of the CDC materials that we just saw earlier in the talk, giving some information about the hepatitis B screening that we can provide as well. Last year, we tried something a little unique in terms of promoting hepatitis B awareness and education, and that was a film screening of the Another Life documentary at our local theater. We were able to rent out the theater, and we were able to show this screening of this film, which is a documentary which exposes the trials of 8 families suffering with hepatitis B in both the United States and China. It's a really beautiful personal story of these 8 families. And following the filming, the screening, Dr. Wong was able to talk to the attendees about the film and about the stories that were in the film and the need for advocacy and addressing cultural misconceptions and the needed efforts that are needed in health policy. So hepatitis B screening, we at the Center for Asian Health are able to offer free screening to our community and to our clinic patients. Here at the clinic at Center for Asian Health, we offer it to all of our patients who see Dr. Sue Wong and our other physicians on board here. We also offer it as a walk-in service for those who would like to get screened for free. We have a screening coupon that anybody who has can walk in with. It serves as both the lab requisition and the payment. And the walk-in is done right here at the Center for Asian Health and various other satellite labs that are affiliated with St. Barnabas Medical Center. We also offer free hepatitis B screening when we go out to the community, such as at various township health fairs, places of worship, and different associations, such as the Organization of Chinese Americans, which we were involved in quite heavily last year. Also last year, just around this time, as we were gearing up for Hepatitis Awareness Month, we held Chinese Wellness Day, where we had over 400 attendees and screened approximately 70 people. That would be wishful thinking, right? We screened 70 people for hepatitis B at Chinese Wellness Day. Chinese Wellness Day was a health fair that was comprehensive in many different medical services, but we did have a concentration and a focus on hepatitis B at that event. Next slide, please. So these are just some snapshots of our different community events. And like I said, they really do offer a mix of being at the local health departments, at a local township health fairs, and places of worship. Next slide, please. And this was our screening of Another Life at the Milburn Cinema last year. We had a good showing of attendees. We also provided giveaways. Giveaways are always a nice way to attract people to an event. And we had a $50 drawing, which also was a good attractor. And we had a very good feedback after that event. Next slide, please. I'm gonna hand it back now to Wenqi, who will talk about our mass communication and media efforts.
So the same thing that we have different kinds of events. So we really hope that, but not every single person like participate our events. So instead to just have an event to promote, we place a lot of we place a lot of ads, and then we're using the social media to really promote this month. So we use the Chinese newspaper and magazine ads with the article to raise the awareness of hepatitis B. The ad is showing the schedule of free screening information, and the article is more about hepatitis B educational information, like basic educational information that, for example, that what is hepatitis B, and then what's the risk in our community. So we're using our Center for Asian Health Facebook page. We do for Center for Asian Health, we have a Facebook page to post some of our future events. So we're using that Facebook page to promote the awareness month and to post our future hepatitis B community events on the Facebook group, and also the mobile app. So the mobile app is it's kind of like a unique stuff in Asian community. We use a lot of people use that for posting the future events, health information, or some of the general health, general life information. So try to just target all of the people in the group. So this kind of app is easy for people to show their interest, and then also to ask questions or sign up the event. For example, we post last year we have our Chinese Wellness Day. We post the event on the one of the app called WeChat, and then a lot of people like follow the group. The people who follow the group saw the event information and participate in the event. During the event date, the participation repost the event on the other WeChat group, and then also attach the event pictures at the same time when the event is going on. So when people saw the event, it have a lot of stuff, and then like giveaway, attractive. So when they saw the picture, they are so attractive. So they suddenly just decide to come to the event. So we can can raise our awareness in this kind of mobile app. So, and then next slide, please. So we can see this is some of the snapshot of our Chinese ads. We have the map that shows the blue map showing people the blue country is the risk country that have more than 2% hepatitis B infect rate. And then on the top of the article, we have on the top of the ad, we have articles just I mentioned like where you can find our free screening, and then why you need to be screened. So, and then also we kind of like telling people that Center for Asian Health received this CDC grant can provide a free screening for everyone. So this year we are going to do the same thing, most of likely the same thing. We have a hospital event, we have community event. So far we already have like 6 events scheduled already. And then we also have the Chinese news, the newspaper ads reserved already. So we are going to do the kind of like do the same thing as last year. But one thing is different from the last year is since we Center for Asian Health moved to a new location. So we decided to decorate our new clinic to raise the awareness of hepatitis on May. So we will place educational information on the waiting area, and then we will encourage patients to ask their doctor about Hep B screening. And in the other hand, we also encourage the patient, family, and friends to get tests in our clinic, right, when they like accompany with the patient. So I think like we just try to do as much as we can as last year, and then hopefully we can just have this new clinic we can raise more awareness and in the community about hepatitis B. Thank you.
Great. Thank you so much, Wenxi and Ruth. Next, we will hear from Alex Sheriffs, Jack Hildick-Smith, and Catherine Freeland from Philadelphia. Alex founded Hep C Allies of Philadelphia, the coalition, and also served as the Viral Hepatitis Prevention Coordinator for 6 years before moving on to a new role at the health department. So we're really glad that she was able to join us and share all the great work she did while as the coordinator. And Jack Hildick-Smith is actually the new coordinator for the Philadelphia Department of Public Health. And then after them, we will hear from Kathleen Freeland, who is the Public Health Program Manager at Hep B United Philadelphia. Thank you, Alex, Jack, and Catherine.
Hello. So do I have control over this now?
I will grant you that. Okay, it's all yours. You just have to advance the slides. Do you got it?
So I'm Alex Sheriffs, and I am my current role is the HIV and Hep C project coordinator out of our AIDS activities coordinating office at the health department. And so I'm going to let Jack I'm going to hand things off to him to get started.
Yeah, so I'm Jack Hildick-Smith. I am the new viral hepatitis prevention coordinator for the city of Philadelphia. So I run a lot of the prevention activities in the city, and part of the job of viral hepatitis prevention coordinator is to serve as the governmental co-chair of our Hepatitis C Allies of Philadelphia, which is our citywide coalition working to improve the continuum of care for people with hepatitis C. And we actually have quite an expansive reach across the city, and that has helped us coordinate our activities and, oh, there we go. All right, so working on the local level, there's definitely a lot of challenges if you work in hepatitis. Pretty much everyone at least the health department level is probably familiar with the lack of funding that comes along with working in viral hepatitis. And that means you usually end up attached onto other programs. So trying to do time-intensive events can be tough because they don't usually get prioritized. That's where having a coalition comes into play. It helps you coordinate activities. You can energize your local stakeholders to get things moving. It also means you can share events, coordinate resources and people, and join on to other events that are happening in your community. It also gives you a lot of opportunity to generate news coverage because of the scale of and spread of your operations. And yeah, it helps you build off of existing infrastructure.
So I'm going to start with an event that was very resource intensive. It involved time and money. But after that, I'm going to show some examples of things we've been able to do with less resources. So you can kind of see both sides of the spectrum when you're thinking about coordinating a Hepatitis Awareness Month event. So in 2015, Pennsylvania and Philadelphia were very fortunate that we were one of 3 sites to get some support from the CDC Foundation to put on an event. The other 2 states were Massachusetts and Florida. So we were at a point where the new treatments had come out and there were some restrictions, and we decided to invite 100 high-level stakeholders from across the state together to have a summit to end Hep C, to try to really push the state to prioritize hepatitis C a lot more and talk about how progress could be made at the different levels along the Hep C continuum. So we invited local experts to speak and present on best practices and challenges, and then each session was followed by a really great discussion period among our participants. And so the people involved were people from the state health department, from local health departments, people who worked with high-risk populations like our harm reduction programs, some clinicians, some insurance companies. So it was a really great array of visitors that we had. And the highlights from this are everyone signed a commitment to end Hep C, which I think was a nice visual way to get people to commit to remaining engaged in hepatitis. And the idea was, what we hoped was that the state would kind of take their signatures on and then maybe continue this event or have some sort of ongoing way to engage with these stakeholders. Unfortunately, I think because the city was pushing the state to make this happen, it wasn't really sustainable in the way we envisioned, but I think this is something that could turn into an annual event if the resources were there and the commitment and having a designated person to help coordinate all this. The other great thing that happened is after this event, the treatment restrictions were rolled back so that there's no longer an abstinence requirement that says people have to be free of drugs for 6 months to go on the Hep C treatment. So that was a huge victory, I think, in part because we were able to bring high-level people together to talk about the impact of treatment restrictions. So that's a very work-intensive financial, you need the money to put something like that on. Now I'm going to go into more low-budget things that you can do for Hepatitis Awareness Month. So I think thinking about how you can customize activities on a local level is important. So in Philly, we have a building called the Pico Tower. It's our energy company, and along the top, they have a scrolling message. And so nonprofits can fill out a form online, and the message will scroll across the top of the building for a couple nights, and it's totally free. So that's something that's unique to our city. It provides a nice little visual for us to be able to use over and over. And it's kind of, you know, a way to put our website literally up in lights. And I know San Francisco did something similar when they announced their End Hepatitis campaign, they lit up City Hall. So I think about a building or a landmark or a tradition in your own community that you may be able to use to apply to Hepatitis Awareness Month. And that's a really great way to customize a message. The other thing that we kind of did locally is had these little Oliver Says flyers made. So these were little signs people could fill out their own personal message, so we could bring it to our HepCat meetings. If we were doing community events, you could have people fill it out. Our partner agencies had, like the person in the picture is an intern at one of our partner agencies. She filled it out. And so these are nice images you can share on social media. It's a nice way to engage with national partners through social media. And I think it's also a resource that you could then adapt for things like Hill visits or advocacy visits with elected officials. So all this took was having a graphic designer who was on our staff design this nice flyer, and then something we can adapt and use over and over again. And then I think another thing on a kind of low budget level is to check the local calendar, see what else is happening during or around May, and try to build hepatitis into existing events. So at the end of April is the Philadelphia Science Festival, and for 2 years, HepCap hosted a booth. So the picture on the top is we had kids design a cure. So we had little bean bags that the kids could decorate, and then we had a little beanbag toss to kind of represent the hepatitis cure. And so that was we kind of used the kids to lure in their parents and be able to give them hepatitis information at our table. So it's also a great way to engage our coalition partners to come and volunteer some time. And then another thing that happened last May was the Pharmacy and Therapeutics Committee meeting. That's the committee that decides on hepatitis treatment or on drug treatments in general and restrictions around drug treatment in the state formulary. This meeting just happened to be in May, so HepCat members went and protested the treatment restrictions, and the committee voted in favor of rolling back treatment restrictions and opening up Hep C treatment access to everyone, regardless of fibrosis score. Unfortunately, the state did not sign off on those recommendations, so we're still kind of fighting to improve access to treatment, but it did get news coverage, and I think it really empowered our coalition members to feel like if we speak up, we can make a difference. And these are all things that fit into the existing calendar of events. So I'm going to hand it back.
Yeah, there's also another thing to keep in mind as far as local calendars are concerned is that June is AIDS Education Month. And what we've done is tacked onto another nonprofit called Philadelphia Fight. They have an AIDS Education Month Prevention Summit. So we submitted a number of workshops for their Prevention Summit just to help work on increasing hepatitis awareness. So we'll be presenting a Hepatitis 101 workshop at their Prevention Summit, and that's right at the beginning of June, so it kind of flows into the next month to keep the hepatitis information going. And that goes along with our theme for the next slide, which we can change it. Alyssa, could you change the slide? We seem to have lost control. There we go. So working off of existing infrastructure in place, if you try and do things like go viral by using online resources, we've had interns in the past make YouTube videos, and you can see those are actually pretty recent screenshots. They have quite a few views, and it's a fun way to get stakeholders involved, so you can involve multiple groups that are involved in your coalition, and it pulls the coalition together. And it's a really easy way to disseminate a message. All you have to share is a link, so you can spread it through email. And it's a really great way to use your volunteers and get more students engaged and get internships for your program. And then lastly is to try and tag team with your other partners, and that's where Catherine will come in. But we have worked with Hep B United to storm City Hall, and that's where you can get a lot of people in the room with elected officials and bring our mascot, Oliver, so you can have some publicity that doesn't cost money and make it an annual tradition so that you're always coming back and reminding people that it's an active thing. Another opportunity that we have coming up in May is we're working with the Prevent Cancer Foundation and Hep B United to do Think About the Link Philadelphia Summit, and that's going to focus specifically on the link between viral hepatitis and liver cancer. And that's a great way to combine resources and get some big voices in the hepatitis community to present. So that way we can utilize lots of resources and really get the message out on a larger scale than if we were working on our own. And so now I can pass it over to Catherine Freeland with Hep B United to talk more about the Philadelphia events.
Hello, thank you, Jack, so much. That was a perfect segue into our Hep B United Philadelphia events, and I can't stress enough how combining resources is really a big theme of what we are doing here at Hep B United Philadelphia. So our main goals for May are to spread awareness, advocate for those impacted by hepatitis B in Philadelphia, and then provide screening opportunities and linkage to care opportunities for our community partners. And I'm not sure, oh, perfect. So our first event coming up in May is a lunch and learn. You can do this without providing lunch and just bring in somebody with, considered to be an expert to speak about hepatitis and the communities that it impacts. We've been working on a social media research project with Dr. Julia Alber from Penn, and she will be discussing her research findings and try to get some input from our community leaders. So this is just going to be an educational session for community leaders who are working on hepatitis or working with Asian and African immigrants in Philadelphia. So we have several health fairs going on, and really this is combining resources because many of these partners reached out to us asking us if we were interested in providing education opportunities. And so we definitely took advantage in as many as possible. We have several internship opportunities where we're letting our interns go and educate our community members. And we partnered with the Philadelphia Corporation for Aging. So we'll have a Hindi health fair in North Philadelphia educating seniors about HPV. We'll also have a free library, a Philadelphia South Philly location adult vaccination presentation where we will also feature our Just V storytelling videos. So really bringing a personal connection to hepatitis B and try to increase vaccination rates in the city. We're also reaching out with the African Family Health Organization, a local nonprofit in North Philadelphia who will work towards educating and providing information on HPV. And then we'll also try to gear them towards some screening events at these education fairs. So we're gonna provide education and resources the first Saturday, and then the following next weekend we'll be providing free screening opportunities. So as Jack kind of touched on, we have the May 19th summit that we're working with the Prevent Cancer Foundation. We're working with HepCat and the Hep B Foundation. Excuse me. And this is going to be a great event. We're really focusing on advocacy here. We have several keynote speakers. We're bringing in Dr. Edith Mitchell from Thomas Jefferson University, who's a community leader for cancer in the Philadelphia area. Councilman O will be presenting a proclamation letter, and then Dr. Tom Freeman, who's our health commissioner, will also be presenting. So we've been able to really make a lot of connections with our community stakeholders. Bringing in councilmen, city officials goes a long way. And we also use social media to reach out to our city officials. The city of Philadelphia has a Twitter handle and Facebook page, and so we always tweet at them to try to get some responses and get them to help us promote our events. We also have some free screenings, and so our previous tabling events will encourage people to come out to our free screenings. We have one on May 20th and then one on the 21st, and each targeting unique communities in Philadelphia. The first will be targeting African immigrant communities, and we've partnered with African Family Health Organization. And then May 21st, we partnered with the Indo-Chinese American Council, RISE, which is a residency physician program, and then the Jefferson APAMSA group. I would also encourage you, if you're ever in need of volunteers, first and second year medical students from the APAMSA organizations are wonderful volunteers, and they can help you with BMI, blood glucose, and other types of non-invasive primary care screening opportunities at health fairs. They're great volunteers and wonderful to work with. We also have, like Alex mentioned, we'll be doing the PICO lights at the end of the month to encourage screening, vaccination, and testing. And then we also have a presentation with the Drexel student group, Phi Alpha Phi, and we'll be presenting on our storytelling project, really bringing a personal connection to hepatitis B and the people that are impacted by it directly. So with that, I think that concludes our Philly events.
Great. Thank you so much, Philadelphia, for sharing. Thank you all for sharing samples of what you have done and what you're planning to do in May, as well as resources that are available. Before we move into the Q&A, we would love to hear what everyone online is planning in your community. So we'll pull up our second poll question. What is your organization doing during Hepatitis Awareness Month? Okay, so it looks like the bulk of activities are, wow, via social media, as well as hosting a testing event or participating in a health fair. It looks like there is a really great variety of activities happening across the month.
Yeah, I agree. And it
That's
did
wonderful.
look like there are a fair amount of others. So if anyone has an event they're organizing or something and they want to share, please feel free to send that out to the group in the chat box. And I recognize that we're kind of short on time. We only have a few minutes for questions. So I will start with the first question, similar to the social media campaign. But Amanda, I wanted to know if you wouldn't mind sharing the hashtags we should be using for Hepatitis Awareness Month to highlight activities and events that we're hosting. And then also if you wouldn't mind telling us about the Twitter chat we're planning for June.
Yes, that's a great question. So usually here at CDC, we've been using for the past couple of years hashtag HepAware, and that's really the one that we kind of get around during May and really use for our promotional efforts and posts during that time. And we're always open to suggestions for others, but that's sort of our main one that we use in addition to some of the other ones that we constantly do, like hashtag hepatitis, hashtag hep B, hashtag hep C, those type of things. But HepAware is usually the one we use for May. As far as the Twitter chat, we're holding a Twitter chat on June 8th at, I think it's 2 p.m. Eastern. And that is NASTAD, Hep United, and NVHR are all co-hosts for that Twitter chat. And it's really a time that we want to give partners to provide their highlights from May and sort of show what they did and what they accomplished, and show pictures or videos or images of different events that they put on during May. And so we hope that you guys will join us. I think right now the hashtag that we're using for that might be hashtag HepChat, but more information is definitely going to come in the next few months, and we'll be reminding everyone of that as well throughout May so that you can collect sort of your accomplishments and make sure that you share them with us in June.
Great, thank you so much. So if anyone has any questions for the last few minutes, feel free to type that into the chat box. And I did receive one question beforehand, so I figured it would be a good one to start with. But I know all of these events had a big emphasis on key populations and communities that are most at risk for hepatitis B and C. And so someone was curious in advance the best ways and strategies to engage these communities and ensure that they're involved in the planning process. So if anyone in the last couple of minutes wanted to share some things that have worked well or ideas for ways to build those relationships with key communities for Hepatitis Awareness Month, that would be great. Winchi or Ruth, did you want to share? Because I know you work very closely with a lot of different communities, like you mentioned in New Jersey, the Chinese community. And then I also know Catherine in Philly has engaged with the African immigrant community and things like that. I was just curious if you had any helpful tidbits for the last couple minutes.
I was just going to say it's always very important and key to identify a champion at one of the organizations that you are going to work with, whether it's going to be a specific group or community. For instance, with the Asian American community, Wenchi has made some great networks and relationships with the Chinese American community, a Suchi Foundation who is local nearby, that does a lot of events, and then in turn they reach out to us to invite us to those events, and they have become a really great partner for us here in northern New Jersey as we focus on Asian American community, and we are starting to branch out to the Western African immigrants, and that's been a little bit of an uphill battle because it's finding that champion in the community. We've done a couple of screening events with that community last year, and we're just kind of following up on some leads, for lack of better words, but like I said, it's finding that champion, making that relationship, and then it winds up becoming a mutual relationship of us helping them and them helping us.
Great, thanks so much, Ruth. And we're at time, but wanted to quickly ask Alex if there's somewhere where we could find that Oliver logo to post throughout the month, because that was a great resource.
We can send it to you to send out. I don't think we have it on our website, but we would definitely be happy to share it.
Okay, great. Well, it is 2 o'clock now, so I just want to thank everyone, all the speakers and everyone who joined us today. And as we mentioned earlier, we will be sharing the slides and the recording, and we'll be sending out that Oliver logo since it was so cute. And we look forward to hearing what you're doing during Hepatitis Awareness Month. So hope you can join us for the Twitter chat on June 8th. And please let us know if you have any questions. Have a great day. Thank you.
Thank you.
Thank you.